Alright, so I'm going to attempt to do substance abuse in 5 minutes or less. So what is the patho behind substance abuse? And the biggest thing to know is that genetics play the biggest role in this. So if you come from a family that are alcoholics, you have a greater risk of being an alcoholic yourself. Family dynamics can also play a role in patho and environment too. So if you're around a lot of people that are using, or peer pressure, that can increase I guess that would be kind of under risk, but nonetheless, that's what I had in the slides. So how do you assess a patient? You look at their symptoms. I'll go over the symptoms. There's quite a few different, but I'll try to be fast. And then you could have a dual diagnosis. This is important. So with substance abuse, not only are they going to have that diagnosis, but they probably will be diagnosed with something else like anxiety or depression. So that is very common to see a dual diagnosis in substance abuse. So as I kind of already talked about, the risks that put you, that are going to increase your chances: family history, male, depression, peer pressure, if you have a presence of mental illness, a lack of family involvement, or using highly addictive drugs. So there is a lot of different types of substances that you can abuse. So for depressants, that would be considered your alcohol, benzos, barbs, and with that you can have that slurred speech, unsteady gait, lack of coordination, impaired attention. And just think about when you see on TV or whatever, when cops pull somebody over that has been using alcohol, they just can't they can't keep their coordination. So that is a big problem you see. And then so with withdrawing, I guess it's completely opposite. So the patient will show increased heart rate, increased BP, increased respiratory rate. So kind of opposite of the symptoms that you see with depressants. So then with stimulants, which is considered amphetamines and cocaine, also I looked this up, it's Molly as well. I might have a cousin down in Florida who uses it, big partier. So with stimulants, you're gonna see tachycardia, elevated BP, dilated pupils, perspirations, nausea, and chest pain. And as I said, withdrawal is opposite. So the patient is gonna be, instead of really high stimulated, they're gonna be low. So they're going to be fatigued, they may be suicidal for days, so very depressed, and have increased appetite. Cannabis, which is just marijuana, that causes relaxation, euphoria, increased appetite, bloodshot eyes, dry mouth, hypotension, and tachycardia. And then opioids, that is considered morphine, codeine, hydrocodone, and oxycodone. So with that, you're going to have those pinpoint pupils, coma. They could have respiratory depression. That's a big one. Unconsciousness. And then their withdrawal, they are going to have increased anxiety, insomnia, and drug cravings for weeks. And finally, hallucinogens, PCP, LSD. We didn't talk about that as much, so I'm not going to really go into that, but that's just another drug category. Okay, so what are you going to give? The two treatments that were in slides were for alcohol, you're going to give disulfiram, which is just a recovery drug from those cravings for alcohol, as far as I believe. And then for opioids, you're going to give buprenorphine. It's in the slide, but that's just a medication that you're going to give to help with that opioid addiction. And then if a patient does have an overdose, you're going to give naloxone. So that was something pretty important that I thought we should remember. And I think that would be it. And non-pharmacologic, you can also have a patient be referred to halfway houses, extended outpatient treatment centers, chemical dependency units, and day programs for chemical abuse. And finally, nursing diagnosis, acute substance withdrawal syndrome, compromised family coping, disabled family coping, ineffective denial, insomnia, anxiety, risk for injury. Yep. So that's about it with substance abuse. We didn't go over that very much, but just know I think these two drugs. Have a good day, guys. Bye.